So I think first I want to talk about the gap plan and where that kind of makes sense, right? With Philadelphia American, and then we can kind of go over some of the other info. I think everyone on here is like aware of how to write the like package, right? The Philadelphia American package for you know as an alternative to marketplace. But go ahead and share my screen. Can y'all see my screen?
Yep.
All right,
Yeah,
let's
we
see
can see
here.
it.
All right, cool. So um, the gap plan, man, it has so many different uses in the way that it can partner with an ACA compliant plan. So it has to partner with an ACA compliant plan. It can't be a standalone type of thing. But this thing, you get to select the benefit amount here, and then I always do the deductible at zero because the whole point of the plan is to kill the deductible and max out of pocket, so it doesn't really hurt the insurance bank account as much. So the benefit that you select, the gap plan will pay 100% of that benefit for inpatient, right? So if someone stays in the hospital 24 hours more, inpatient activates and it pays the total amount up to the $10,000. So it pays the actual expense incurred, non-scheduled type of benefit up to the 10,000, and it'll pay 100% of whatever those costs are after the primary insurance that's ACA compliant kicks in. So this runs as a secondary, but the price point is next to nothing compared to what it does. The 5390 is for a 26-year-old male. If you run on female, there isn't really any difference. 5390, and then if you go like 40, cost is 8680. Go to 64, cost is 13680, and this works in tandem with marketplace and Detego Health and any private insurance that's ACA compliant that you can stack this along. It also pays 50% for outpatient. So anything and everything that happens outpatient except for prescriptions, non-complicated pregnancies, it will kick in for if there is a complication during pregnancy. But if everything runs smooth, it doesn't kick in. And preventative wellness, like vaccinations and stuff. So if someone gets an outpatient surgery, it'll kick in for half of the cost after the primary plan kicks in. So say the primary plan kicks in and max out of pocket is 10K and the max out of pocket is reached on the outpatient procedures, it'll pay half of that. So it'll pay 5K. So that effectively lowers the max out of pocket by half to 5K. And with inpatient, it would take care of the whole thing, brings it down to a big whopping zero. Just like all the other pallet plans, there is a 12-month pre-X, so keep that in mind. Things to always keep in mind with PALIC, right? 12-month pre-X, wellness preventative, and prescriptions and non-complicated pregnancies with this gap plan. So when we're looking at like a Detego plan, any of these up here, I feel like the First Health, the Health Smart, and the PHCS are little hidden gems because we just look at the First Health, and there's no network with the Gap plan since it's attached to an ACA compliant plan and picking up the slack of whatever the ACA compliant plan does pay. So the reason I say that these are hidden gems is because if you look at the summary of benefits on all these, they're 20% coinsurance before deductible is met for facility, right? Professional is after deductible, but facility is before deductible. So the diagnostic tests, the blood work, um, the I like to think of the facility fee as you've walked into the facility and you're sucking their air. That's the fee that they charge you, right? You're sitting in their chair, you're taking up their space. That's what we can attribute to being a facility fee. Where this really kicks in is your rent for staying in the hospital. So your facility fee for the hospital room, that's your rent, right? You're staying in the hospital. That's, on average $2,800 a day. Well, this pays this kicks into where you're only responsible for 20% before the deductible. And that 20% coinsurance before deductible on the facility fees on the plan do count towards the deductible max out of pocket on the plan. But where this really can kick in is we've got a max out of pocket over here, 7,350. You know, you got 8,000 here. So we got 120.40 on top of First Health, and it just makes the plan function better. I think even on the marketplace, if you take a you know, a bronze or catastrophic level plan and you add in the gap plan, it makes it perform at the level of like a platinum plan, right? Because you're getting max out of pockets that are like $5,000 or even lower, depending on the one that's available. And so just to give you an idea of what the cost is on this First Health PPO, here are the premiums. So for someone that's 18 to 29, 661.81. On the HSA 2500 and 7350 is 570.48. If someone is like 18 to 29, so we'll just say that this person is 18. Let's see here. 18, $48.40 added to this at $618.48, basically, or 619 bucks. If you run it here, and you can see that if you got a 7350 deductible, it's going to be matching the max out of pocket. So essentially, that's the catastrophic level coverage at Detego, and now you've cut that max out of pocket in half to be like a little over $3,500 for outpatient, and then $0 for inpatient. Keeping in mind the few things that it doesn't cover in the 12-month pre-X, but I mean, to get that to that level of 7,350, this would be your closest thing, and you're looking at roughly $70 or a little less than $70 cheaper than just going over to this plan. And you also have the fact that even though this is a 7,350 deductible that matches the max out of pocket catastrophic level of coverage, it still has that 20% coinsurance before deductible is met on the facility fees. So stacking the gap plan along with the 7350 on the First Health network, I think is a phenomenal thing to do. Out of these networks that have the 20% coinsurance before deductible is met, I'd say that First Health is probably the most exhaustive. As y'all are aware, Philadelphia American, there are other plans run on the First Health network as well. So if you want to get creative, I encourage people to get creative, right? So um, the gap plan covers a lot, but you can always throw in an optimum, a 1-unit optimum. Let's see, I'll deselect that. We'll go here. It opens up the 1 unit for $65.33. So you can have a scheduled benefit plan that pays thousands of dollars per day in the hospital, where someone could actually make out with having more money in benefits than the cost, and getting excess benefit checks from Philadelphia American, even running the optimum on the 1 unit um, as a alongside the major medical that you put it on with Detego, or even the marketplace. So there's opportunities to be creative and meet your clients' needs in different ways. I want to take a minute and stop it and see if anyone has any questions. Let's see. All right. So if that's the case, and we'll move on. Let's see. I want to look at the higher cost plans, like the Aetna Livelihood. You got PPOs and EPOs on this, but you have the Aetna Livelihood. All of the PPOs and EPOs are 10,000 max out of pocket, except for the HSAs. I think they're a little bit smaller, but just to give you an example, you got a 2,600 PPO here, and we'll look at the summary benefits on this. and it's a 10,000 max out of pocket. So even though the deductible is smaller, the Aetnas are running at 10K max. So stacking this gap plan together with that really makes a lot more sense to me. And the other thing is too, I'm going to pivot away from the gap plan, is that we have, you know, it seems like with Detego Health that Philadelphia American is becoming less and less relevant. I would argue that it's just as relevant today as it has been for forever because of the price point. There are folks like, if you run someone that's 26 years old on the typical package that you would build for them with Philadelphia American, which just to give you guys an idea, what I do is I do 250 on the calendar year max, 5 on the deductible, 2 on the 2 units for the optimum, accident 2 units, critical illness 20K, specified disease 250 calendar year max, and then 25K deductible. And that's 176.31. And I can tell you for sure that there is no plan available on the Detego um, suite of plans, if you will, that is less than that. So we put in a 26-year-old here, 239, right, for on the max card plans, which are the cheapest limited benefit plans that Detego offers. And when you look at the limitation on these max card plans, they only get 5 days of inpatient stay, right? So if they stay day 6, it'll still run through the network, but the plan itself is done paying. It's not going to pay anymore on day 6 plus of staying in the hospital. So, even though Philadelphia American is cheaper, I'd say that if Philadelphia American was considerably more, not considerably, but a time and a half more than it is now, and it was more expensive than this right here, I'd run the Philadelphia American because it doesn't have the limitation that the Max Card has. Um, the Max Card gives you, how do I put it? The Max Card gives you a clear, definitive, this is what happens in these scenarios. And there's a little bit more uncertainty with Philadelphia American because it doesn't say that, your copay is X for this procedure. Instead, it says we're going to pay this much for these different things, regardless of whatever the cost is. So even though there's a little bit more uncertainty with Philadelphia American, I think that the Philadelphia American plans are stronger than the Max Card plans because it doesn't have a limitation of 5 days in the hospital. And just to give you guys a refresher, I'll pull up a summary of benefits on the Max Card. So the Max Card runs on the First Health PPO. It is an EPO structured plan, so no out-of-network coverage, but still runs on the First Health PPO network. And you can see that there is a small deductible of 300. Everything is copays after deductible is met. So, for instance, primary care visit is a $50 copayment after deductible. So, the only real disadvantage is the limitation. You get 10 visits per member per plan year, all inclusive for primary care, specialist, urgent care, mental health only therapy visits, and also your physical therapy visits and stuff like that too. So that's all you can get. Now I know that most people that would qualify for this aren't going to be going to the doctor 10 days, 10 different times throughout the year, but it's possible they could go to urgent care 2 or 3 times. They could go to their primary care once or twice. They could go to, a specialist. And next thing you know, they used up all 10 and they still need more. Whereas Philadelphia American, even though it doesn't have a limitation in the number of times, the limitation is in, the pay. Well, it does have a limitation number of times. Um, it's higher. It's 16, I believe. Let's see if we can go there. Yeah, 16 days. So you have something that is guaranteed for 10 at a $50 copayment after deductible, or you have something that is guaranteed at a dollar amount with 16. The big deal on this that I think is that we should consider is the inpatient part, right? So we don't write a one unit Philadelphia American Optimum plan and package it with everything else you know, um, to compete against the marketplace because one unit is too skinny on benefits. So it'll either be two or three. On the 2 unit plan, the middle plan here, for injury, you get $7,000 a day of coverage, 21,000 by day 3, and then 5,500 on day 4, and then 4,000 each day after that, up to the calendar year max of what you selected when you built the plan, which 250,000 is what I typically do, or half a million is available, or even a million, and that's per person insured per calendar year. So the thing is we've got a lot more coverage here, especially considering that the average cost of someone staying in a hospital on a per day basis through network discounts is about $2,800 a day. So there's more than enough coverage on the room rent, right? That's what it's paying out on. It's literally paying out on each day you're in there. So that versus, let's see here, inpatient, $850 copayment per admission after deductible, paid at facility, semi-private room. Let's see, this is mental health. That's my bad. Hospital stay. Here we go. $850 copay per admission after deductible. You get 3 hospitalizations per benefit period and a 5-day limit per hospitalization. So if you're in the hospital for 6 days or 10 days, right? Each day after 5, it's on you. It's run through the network, but it's on you. I'd rather have this that I know is guaranteed to pay it at least 4K a day due to an injury or 3K a day due to sickness. And so really it depends on what the member is willing to do. Are they okay with something that pays a specified benefit amount on a daily basis, not knowing what the actual cost of service would be at the hospital? Or are they okay with definitely knowing what the cost is as long as they don't stay in the hospital more than 5 days, is what it comes down to. And the premium difference does matter. I mean, the lowest cost that you can get on these max card plans. So the lowest cost plan would be this one that Detego offers. Pricing would do someone that's 249 a month. It's really hard to beat, but Philadelphia American can get close to it. So we got 26. We'll make them 40. 240. So right next to each other. Philadelphia American's actually $9 a month cheaper. And I think that there's more coverage because you not only got that optimum plan that can kick in, you got your specified disease, you got your critical illness, and you got your accident. So all of those things working in tandem together, I think, uh, do make more sense for somebody than the max card. But it's going to be up to the member. So I'm just kind of showing this as an option. Like if a member is kind of hesitant and you're presenting the max card and they're not sure about, day 6 and beyond, show them this. Or if you're showing them this and they want something with more certainty and they don't think that they'll be in the hospital for more than 5 days. I mean, no one does, but they're pretty certain of it and they're willing to take a gamble, write them on the max card. So, does anyone have any questions about that? This is about all I had to say.
Oh, I don't know
Okay,
if
cool.
anybody had any specific
Does that make
questions.
sense to everyone? Okay, cool. So we can be creative. We can do a lot of things through here, but I think we can, even just run a Detego with the um, the gap plan is going to make clients a lot happier, right? And the good thing about the gap plan is that they do get their own card as a secondary insurance that they can turn in. They don't have to self file claims. So I mean, I'm sure there will be an instance where that'll come up, but more often than not, they don't have to. So that's about all I got.
Cool. Thank you,
So
Jordan. Yeah, I don't know if anybody has any questions or anything. Now would be the time to ask. And then, Jordan, is it best if anybody has questions, follow up questions or anything like that, should they reach out to the support email?
Absolutely.
Okay.
That that email has higher visibility and is being watched by
Okay.
staff now as opposed to just, you know, little old me.
Sure. Yeah.
And they can always text that number. That goes to that's our support number that has better visibility because I'm out.
Sure. Okay. Cool. Yeah, I'll make sure that I have your contact information attached to the webinar too, um, for like the support number and everything. But yeah, if nobody has any questions or anything like that, then Jordan, we appreciate your time. Thank you for that. I'm sure everybody appreciates the explanations and everything. So cool. Well, if anybody has any follow up questions, feel free to reach out to Jordan, myself. I can always get you guys in contact as well. But yeah, we appreciate your time. Thank you so much for taking the time out today.
Awesome. Well, thank you guys for showing up, and I love it when it's short and sweet.